Bismillahirrahmanirrahim. A 41-year-old woman, gravida 2 para 1 at 35 week of gestation, come to the emergency department with uterine contraction. That started approximately 6 hours ago after a trip to the beach. The patient feels 3 to 5 contractions every hour. She has been managed with weekly injection of hydroxyprogesterone for a history of vaginal delivery after presenting in spontaneous preterm labor at 34 weeks of gestation. 2 days ago, the patient had a routine rectovaginal culture that was positive for group B Streptococcus. Blood pressure is 110 by 80 and pulse is 92. Digital cervical examination shows the cervix to be closed. Bedside ultrasound shows an estimated fetal weight consistent with 35-week gestation and a vortex presentation. The fetal heart rate tracing is normal and tachometry shows irregular uterine contraction. Which of the following is the most appropriate next step in management of this patient? Administer betamethasone, administer endomethacin, administer magnesium sulfate, administer penicillin, measure cervical length by ultrasound, reassure patient and discharge home. So this patient is 41-year-old and she came to us at 35 week of gestation with mild irregular uterine contraction. On digital cervical examination, the patient's cervix is closed. So this patient having the false contraction. This patient having the false contraction because this patient present at 35-week gestation with irregular contraction and a closed cervix consistent with false labor. So false labor is a mild irregular contraction that causes no cervical change. There is a latent labor. So the latent labor is a regular contraction with increasing frequency and intensity that causes gradual cervical changes. The third one is the labor. With the labor is regular painful uterine contraction that causes cervical change. This patient had a preterm delivery. Her presentation is consistent with false labor and she can be discharged home with routine prenatal care. Come to the so here the correct option is choice F. Reassure patient and discharge home with prenatal care. Come to the incorrect one, choice A. So, betamethasone decreases the incidence of respiratory distress syndrome in preterm infant. Choice B. Endomethacin is a common tocolytic which is contraindicated after 32-week gestation due to potential closure of the ductus arteriosus. Choice C. Magnesium sulfate is administered for fetal neuroproduction before 32-week gestation. Choice D. So penicillin administration prior to labor is not beneficial due to rapid bacterial regrowth necessitating treatment in labor. Choice E. During the third trimester, the cervix normally begins to efface and cervical length measurement after 30 weeks cannot be used to predict preterm birth. Thank you.